What could be the possible reasons for bleeding 10 days after the period?
Hey everyone! Welcome back to our channel. Today, we'll be discussing a common concern among women, bleeding 10 days after their period. Many of you have reached out with questions about this, so we thought it would be helpful to provide some insights into the possible reasons behind it. Remember, if you're experiencing any unusual bleeding, it's always best to consult with a healthcare professional. With that said, let's dive into the topic.
Is it normal to bleed 10 days after the period?
First things first, is it normal to experience bleeding 10 days after your period? Well, every woman's menstrual cycle can vary, so what's considered normal for one person might be different for another. In general, a menstrual cycle typically lasts around 28 days, but it can range from 21 to 35 days. Bleeding that occurs outside of this typical cycle length might be a cause for concern. However, it's important to note that there can be various reasons for bleeding outside of the regular cycle.
Hormonal imbalances.
One possible reason for bleeding 10 days after your period is hormonal imbalances. Hormones play a crucial role in regulating the menstrual cycle, and any disruption in their balance can lead to irregular bleeding. Conditions such as polycystic ovary syndrome, PCOS, thyroid disorders, or changes in contraceptive methods can all contribute to hormonal imbalances, potentially causing abnormal bleeding patterns.
Uterine abnormalities.
Another potential cause of bleeding 10 days after your period is uterine abnormalities. These abnormalities can include conditions like uterine fibroids, which are non-cancerous growths in the uterus, or polyps, which are small, benign tissue growths. These abnormalities can disrupt the normal shedding of the uterine lining during menstruation, leading to bleeding outside of the regular cycle.
Infections and inflammation.
Infections and inflammation within the reproductive system can also cause bleeding outside of the normal cycle. Sexually transmitted infections, STIs, such as gonorrhea or chlamydia, can cause inflammation and lead to abnormal bleeding. Similarly, conditions like pelvic inflammatory disease, PID, which is an infection of the reproductive organs, can also result in irregular bleeding.
Pregnancy complications.
While bleeding 10 days after the period is not commonly associated with pregnancy, it's important to consider the possibility of pregnancy complications. Implantation bleeding, which occurs when a fertilized egg attaches to the uterine lining, can be mistaken for a period. Additionally, conditions like ectopic pregnancy or miscarriage can cause bleeding outside of the regular menstrual cycle. If you suspect you might be pregnant or are experiencing severe pain along with the bleeding, it's crucial to seek medical attention immediately.
Other factors and when to seek medical help.
Apart from the mentioned reasons, there are other factors that can contribute to bleeding 10 days after the period. These include stress, extreme weight changes, medication side effects, or underlying medical conditions such as endometriosis or cervical or uterine cancer. If you're experiencing persistent or heavy bleeding, severe pain, or any other concerning symptoms, it's important to consult with a healthcare professional to determine the underlying cause and receive appropriate treatment. That wraps up our discussion on the possible reasons for bleeding 10 days.